Hello everyone, welcome back to the channel. Today we are discussing about the drug interactions. When drug interactions happen, when one drug administers with the another drug, the drug interaction will be going to happen. The drug interaction may be pharmacokinetic or pharmacodynamic. So we are talking about the type of drug interaction. One is the drug-drug interaction, drug-food interaction, chemical drug interactions, drug laboratory test interactions, drug disease interactions. If any particular person have disease condition, and if I am taking the drug, the disease state with the drug causes drug disease interaction. Now I will see the mechanism of drug interaction. There are two type of drug interaction. One is pharmacokinetic drug interaction, another one is the pharmacodynamic drug interaction. In pharmacokinetic drug interaction, we can study absorption, distribution, metabolism and elimination, means ADME interaction study. In pharmacodynamics, we can study agonist, antagonist effect, electrolyte balance and receptor site. Next is, what is the pharmacokinetic drug interaction and what is the pharmacodynamic drug interaction. In pharmacokinetic drug interaction, modification of pharmacological response by altering the concentration of the drug in the tissue fluid, also called as the ADME interaction, means absorption, distribution, metabolism and elimination interactions. Second one is the pharmacodynamic drug interaction. In pharmacodynamic drug interaction, modification of pharmacological response without altering the concentration of the drug in the tissue fluid. This is the major difference between the kinetic drug interaction and the dynamic drug interaction. In kinetic drug interaction, alter the concentration of the drug in the tissue fluid, but in dynamic drug interaction, without altering the concentration of the drug in the tissue fluid, but modification of pharmacological response is constant for both the cases. This slide will be going to discuss about absorption. So what are the drug interaction we can see with the absorption? Complexation in absorption, alteration in GI motility, alteration of absorption due to food, alteration due to enzyme, alteration of pH, and last one is the alteration due to malabsorption. If particular patient having more malabsorption, then it going to affect the absorption. First, we will discuss about alteration of pH. The drug absorbed that must be in unionized form. Acidic drug needs acidic media. For absorption, drug must be in unionized form. For excretion, drug must be in ionized form. If acidic drug exposed to basic media, then drug will ionize. So ionized drug will not absorb. For example, itraconazole plus antacid. Itraconazole is acidic drug, antacid is basic drug. So if we combine acidic and basic drug, definitely it will alter the absorption. Same aspirin plus antacid, heparin plus antacid. These are the examples of alteration of pH. Second is the complexation of the drug. Complexation also affect the absorption by forming insoluble complex. This insoluble complex not absorb. For example, tetracycline plus antacid. If we combine them, it will delay the absorption. Tetracycline plus iron create complexation and will delay the absorption. These all are the examples of complexation of the drug. Third is alteration in GI motility. Some drugs may affect the rate of absorption, some may affect extent of absorption. Paracetamol plus metoclopramide increase in absorption, paracetamol plus propanthelin decrease in absorption. Atropine, tetracyclic antidepressants, opioid drugs reduce gastric emptying, delay in absorption. Next is alteration in food. Isoniazid, lincomycin, ampicillin, azithromycin, tetracycline decreases absorption, whereas itraconazole increases absorption. Some drug decrease absorption, whereas some drug will increase the absorption. Malabsorption. Laxative causes malabsorption, result in decreased absorption of vitamins and nutrients from GIT. If I am taking any laxative drug and vitamin drug, the absorption of vitamins and nutrients from GIT is decreased. Some enzyme alteration. If folic acid taken with phenytoin, phenytoin decreases the absorption of the folic acid. Next one is the distribution. Distribution plays an important role here. Alteration in distribution leads to drug interaction. It may due to plasma binding protein. The drug may exist in free form or bound form. The drug which present in free form is more active and shows action more. If drug present in bound form, no action. These are the displaced drugs and these are displacers. If I am taking salicylates, salicylates displaced by the warfarin, then what is going to be happen? It increase the clotting time. Next is the sulfonamides. Sulfonamides displaced by the tolbutamide. It increase the hypoglycemic action. These are the few examples of displaced drugs with displacers and their action. Sometimes these are increased or sometimes these are decreased. Next is the metabolism. For metabolism, two terminologies are coming. First is the enzyme induction. Second one is the enzyme inhibition. Enzyme inductions, enzyme inducers accelerate metabolism and leads to therapeutic failure gate and shows decrease in the effect. Enzyme inhibitors inhibit the metabolism of one drug by another drug may lead to toxicity of the former drug. One is decrease in the effect and second one is the create the toxicity. This is the difference between induction and second is the inhibition. These are the example of enzyme inducers. They induces the metabolism of these drugs. For example, if barbiturates is taken with oral contraceptives, it decreases the contraceptive action. If griseofulvin is taken with warfarin, decrease in anticoagulant action. Last one is the excretion. Urinary pH is very important in excretion. Unionized drug absorb fast and ionized drug eliminate fast. In elimination, if drug is acidic, we need basic medium. So the drug get ionized, then this ionized drug get eliminated. Salicylates and phenobarbital both are acidic drugs, so both drug needs basic pH urine. So here we introduce sodium bicarbonate. Amphetamine and quinidine both are the basic drugs, but drugs need acidic urinary pH. So we introduce ascorbic acid to eliminate the drug. For amphetamine and quinidine, ascorbic acid is needed for elimination. For salicylates and phenobarbital, sodium bicarbonate is needed for the elimination. This picture shows the ADME means absorption, distribution, metabolism and elimination in drug interaction. First is the absorption. In GIT, drug or food alters absorption of the drug. Second is the distribution. In blood, protein drug binding competition for the binding site. Third is the metabolism in the liver, induction or inhibition of drug metabolizing enzymes. And last is the excretion in the excretory system, mostly in the urine, modified drug excretion pattern. Now we will discuss about pharmacodynamic levels. It will focus on agonist, antagonist, receptor and electrolyte balance. First we will discuss about agonist. So here agonist drug warfarin plus aspirin. Warfarin is an anticoagulant drug, also aspirin is an anticoagulant. It will increase in anticoagulant action. Next is alcohol plus sedatives. Alcohol also have sedative action. If alcohol is taken with sedative drug, it obviously increase in sedative action. Next is the antagonist drugs, means one drug inhibit the activity of another drug. For example, thiazide diuretics plus insulin, salbutamol plus beta blockers, opioids plus naloxone, acetylcholine plus atropine, histamine plus adrenaline. Then change in electrolyte and fluid balance. While changing the level of electrolytes, it also affects the pharmacodynamics. First is the cardiac glycosides. Heart becomes more sensitive and diuretics decrease potassium channel which result in arrhythmia. Second is the diuretics decrease sodium and lithium toxicity occurs by sodium depletion which results in lithium toxicity. Receptor site interaction with receptor could beneficial or harmful. When the drug binds to receptor, sometimes it beneficial and sometimes it will be harmful. It's all for the drug interactions. For more details, please check out the link in the description below, and don't forget to subscribe the channel for more study tips.